I'm Harry Nickerson, and this project continues my previous Ingenious Plus initiative where I developed an AI-powered retinal screening solution for smartphones and a lens holder for a smartphone. This solution required mydriatic drops, which are prescription and require a doctor to administer. This year, I trained a new image classifier to detect many more diseases and built a camera that doesn't require mydriatic drops. Millions of people worldwide struggle to access proper eye care, whether due to long wait times, high costs depending on where they live, or simply living too far away from a specialist. I've been working to change that by developing an AI-powered screening tool and a portable retinal camera that allows people to take their own fundus images without dilation, making early detection easier than ever. Unlike my first version, which only screened for RP and required mydriatics, which are pupil dilation drops, my new AI detects multiple retinal diseases, and the camera I designed captures high-quality images without the need for pupil dilation. This makes screenings happen anywhere, at home, in a clinic, or even in a pharmacy. This technology is particularly helpful for patients in remote areas who can't travel to specialists, people with financial barriers who can't afford expensive hospital tests, doctors who are looking for a fast, portable screening tool to prioritize patients based on urgency. Retinal diseases are often hereditary, meaning early detection can help families take proactive steps. My own mom was misdiagnosed for years until my diagnosis led to her getting reevaluated. If a tool like mine had existed earlier, she might have received the correct diagnosis much sooner. My project isn't just about making AI smarter. It's about making healthcare more accessible for everyone. Crucially, the entire solution is open source. I am releasing all design files, source code, and research documentation freely, inviting innovators, researchers, and healthcare professionals worldwide to use, improve, and extend the technology. By fostering a collaborative, open community, I aim to accelerate research into retinal diseases and drive continuous improvements in diagnostic accuracy, ensuring that this solution remains accessible to all. My diagnosis with RP was unexpected. It took multiple accidents before I finally got answers, which made me wonder, what if there was an easier way to screen for retinal diseases earlier? I started researching and I found common diagnostic features of RP, dark pigment clumps in the retina called bone spicules. That led me to train an AI to recognize RP in fundus photos, which I submitted to Ingenious Plus last year. But I didn't stop there. Over time, I expanded the AI's capabilities to detect multiple retinal diseases, not just RP. To make the screening process even more accessible, I needed a way for people to take retinal images themselves. My first camera required mydriatic drops to be administered into the eye, which made it convenient and created many barriers for patients, including costs in acquiring a prescription. My new model is a completely non-mydriatic camera using infrared light for alignment and a quick white light flash to capture the retina before the pupil constricts. By combining AI-powered screening with an easy-to-use, affordable camera, I'm making retinal disease detection possible for anyone, anywhere. Developing an AI-powered diagnostic tool isn't just about coding. It's about having high-quality data. I collaborated with doctors and researchers to acquire medical images, ensuring the AI was trained on diverse datasets for better accuracy. For the camera, I spent months researching the best components to capture high-quality, low-cost fundus photos without dilation. I decided to use a Raspberry Pi and infrared light, which helps align the image without triggering pupil constriction, and a brief flash of white light ensures the retina is illuminated just long enough for a clear photo. I also designed the AI system to minimize errors. The first classifier verifies whether an uploaded image is a valid fundus photo, the second checks image quality, and the third detects signals of retinal disease. This layered approach makes the system more reliable and user-friendly. With long wait times for eye care, this tool can help prioritize urgent cases, ensuring people who need immediate treatment get seen faster. This project helps people who struggle to access eye care, whether due to financial, geographic, or logistical barriers. It's useful for patients who live far from specialists, doctors who need a portable screening tool, and even families who want to check for hereditary conditions. Since retinal diseases often progress silently, Early detection is crucial. My tool makes screenings quick, affordable, and accessible, without the need for hospital visits or expensive equipment. Most AI-based diagnostics tools require specialized hospital equipment, and no widely available AI can currently detect multiple retinal diseases from fundus images. There are also no currently available image classifiers that can detect RP. My classifier changes that. Some handheld, non-mydriatic cameras exist, but they cost up to $10,000 and are mainly used in clinical settings. My design is far more affordable and intended for both professional and personal use. This combination of affordability, portability, and AI-powered screening makes my innovation better than the competition. One challenge is getting regulatory approval, as medical devices require certification before widespread use. To navigate this, I plan to collaborate with medical professionals who can recommend the tool to patients and help me gain this approval. Another challenge is sourcing affordable, high-quality lenses for production. I'm actively researching suppliers to find cost-effective options that don't compromise image clarity. I've worked with Fighting Blindness Canada, FBC, Dr. Joanne Robitaille, Dr. Corey Smith, and ICAR CNR. FBC connected me with ICAR CNR to provide retinal images for AI training. Dr. Robitaille gave insights into clinical procedures and lent me a 20 diopter lens for testing. Dr. Smith helped me reach out to hospitals for additional image datasets. Going forward, I aim to collaborate with more international research groups to expand my dataset. The more diverse the data, the more precise the image classifier will be. Funding would help refine the AI and expand access to the technology. Specifically, I'd use it to acquire more retinal images to improve the classifier accuracy, produce more non-mydriatic cameras for testing and distribution to get feedback from doctors and technicians, and make the tool available to hospitals, clinics, and possibly pharmacies. Eye care is often expensive and inaccessible, yet early detection prevents irreversible vision loss. My goal is to ensure that cost and distance are no longer barriers to proper screening. This funding would bring me closer to making that a reality. I want to thank Ingenious Plus for supporting my innovation last year and helping me make retinal care more accessible for everyone.